It is one of the most chronic, painful conditions. We're talking about fibromyalgia. Numbers show at least 10 million people in the U.S. suffer from this, and we're getting some answers on what it is and how to treat it. Joining us is local neurologist and pain management expert, Dr. Chad Domingue with the Avila Physician Network, to tell us more about this. Thank you so much for joining us, as you do every Thursday.
Good afternoon. Happy early 4th of July to everybody.
Yes, happy 4th of July early to you as well. So let's start, in case people don't know, what are the symptoms of fibromyalgia and how do you diagnose this?
Yeah, this is a tough disease, Liz. I mean, imagine diffuse muscle pain 24 hours a day. And these patients can also have chronic fatigue, problems sleeping, mental distress. I mean, these are people that have a host of issues. It could be a genetic problem, but also there's environmental, smoking, obesity, and a lot of these patients have traumas throughout their lives. Despite the name, it's not a primary disease with the muscle, it's a neurological problem. So normal people feel sensation and pain. These patients have a heightened sensation of pain. So normal things that you and I feel are very painful to them. I like the analogy of a volume on a TV. So imagine the neurons that control pain or perceive it, the volume is just turned too high and they can't turn it down. We can actually do a PET scan where we see abnormalities in a brain, part of the brain called the hippocampus. And when we do a functional MRI and we give these patients some pain, we see increased blood flow to their brain. So this is an abnormality with the central nervous system.
Wow. Yeah, explain a bit more again, on exactly what would cause something like this.
Yeah, so when you look at fibromyalgia, it's a diagnosis you get to after you rule everything else out. So we call it in medicine a diagnosis of exclusion. There is no one test that proves it. So you want to rule out every other thing that can cause this: lupus, rheumatoid arthritis, thyroid issues, multiple sclerosis, problems with muscles, electrolyte abnormalities. So you usually see a neurologist or a rheumatologist, and you do a bunch of blood work, a bunch of MRIs, nerve studies, and basically once you rule everything else out, then you kind of come to the diagnosis of fibromyalgia.
Right. And no doubt a lot of doctors locally treating patients dealing with this chronic pain daily. So what are some of the treatments? What's the best one to try to deal with this? Or if there isn't a cure, how do you live with this?
Yeah, one of the things I do with these poor patients is I just reassure them. There's a lot of negative stigma that comes with this diagnosis. These people get turned away by doctors, they get looked down upon. And the first thing is to make them understand this is a real disease process. It's not just quote unquote in their heads. You know, when you look at the natural things, yoga, Pilates, acupuncture, supplements, vitamin D, omega-3 fatty acids, magnesium malate's been shown to be very helpful. There are 3 FDA-approved drugs for fibromyalgia: Cymbalta, Lyrica, and Stavella. All these medicines, though, have a lot of side effects: weight gain, sleepiness, nausea, vomiting. So sometimes the medicines are worse than the disease itself. You know, at the end of the day, there's no cure. These people have to figure out, a regimen that works for them where the side effects are not too bad, and just figure out a way to manage it. And again, these are very difficult patients, and I really feel for them when you see how bad of pain they have to live with.
And if you're younger and you're saying, I want to figure out a way to try to avoid this as I age, is there anything you can do?
Well, obviously the genetic stuff is what it is, but we talk about obesity, smoking, active lifestyle, active mental lifestyle, taking care of your body. But I could tell you, I treat a lot of patients with this disease process, and unfortunately, a lot of them have had some very difficult life traumas that kind of set this into motion. And unfortunately, it's not much you can do about that.
But thank you for bringing us our attention to this and some of the possible ways to help at least make it a bit livable. Appreciate it, Dr. Chad.
Absolutely. Hope everyone has a safe holiday. Be safe and good out there. Right?
Yes. Okay, you too.